I guess I should have said this before I hit record. I'm in an Airbnb in Denver and there's no workspace, so I am sitting in a bed. So if you see me adjusting pillows or a small dog coming up and getting in my face, that is why. So my apologies. All right. Well, we'll go ahead and move forward. We've got about 90 minutes on the schedule for today. We may finish earlier than that. We may take that full time. There's definitely going to be some opportunities at the end of the presentation to ask questions. And I may take some breaks as we move forward to see if there's any specific questions about particular items. All right. So I am just going to give a little bit of background information on CWP and WorkSource Oregon. I know some folks are going to be aware of these already, and this is really going to be surface level. And again, happy to provide more detailed follow-up or answer any questions about anything you may hear today after. So Clackamas Workforce Partnership, or CWP, is the nonprofit workforce development board surveying Clackamas County. We've been the certified workforce board for Clackamas since 2001, when workforce boards were first established by the Federal Workforce Innovation Act, which was later reauthorized as the Workforce Innovation and Opportunity Act, or WIOA, which you may hear me reference. So we are one of Oregon's 9 workforce boards, and Clackamas County is one of the state's 9 workforce regions. And the workforce board's role is to strategically invest federal, state, and local resources in programs and services that address regional workforce challenges, things that impact both employers and job seekers. So through WIOA, workforce boards are meant to function with guidance from local employers, local elected leaders, and other organizations such as schools and community-based nonprofit providers to help inform the services and programs that we're working to develop and fund, and make sure that they meet the needs of local employers and job seekers. And many of these services are provided through something called a one-stop shop, which I'll dig into a little bit more here in a few minutes. These are essentially career resource centers that are provided through funding and support from that WIOA law that I mentioned earlier. And if you can, go ahead and mute if you are able to until we get to the Q&A period. Awesome, thanks, folks. So a little bit more of CWP's core functions. We, along with our counterparts across the state, have 13 functions that are outlined under that WIOA policy. I've kind of summarized them into the core things that we do. So really, CWP works to convene what I call key stakeholders or key constituents from the private, public, and nonprofit sectors. And those include business and industry representatives, social and human service providers, education and training providers, as well as elected leaders and community advocates to help identify some of the key challenges impacting both the employer and business community, as well as people, individuals looking for work. And in that convening role, we also help to facilitate like coordination and collaboration among those different organizations or entities. We also are responsible for not only investing existing funds or resources, but growing that pot of money to help support training, education, and employment services. And we, all workforce boards are prohibited from direct service. So we don't do any sort of employment or training activities ourselves, but we do contract them out with primarily nonprofit organizations, but also community colleges and other educational institutions to provide direct service to job seekers. One of our other core roles is, I mentioned earlier, that one-stop shop, WorkSource Clackamas, is to help with management and operations of WorkSource, because it is an organization that is made up of multiple different institutions and agencies working together. Our role in that kind of WorkSource family is to help support partnerships and align service delivery among all the different providers. And then lastly, we function as an advocate in helping to address and remove disparities that hinder people's ability to not only access and keep employment that meets their needs, but also removing barriers to some of the resources available to help them develop those skills to obtain that employment. So a little bit more about WorkSource Oregon. Again, under WIOA, that federal law, every state in the US has a public workforce system. The names may vary depending on where you are. For example, North Dakota may be something entirely different that does not include the word WorkSource. But in Oregon, our state workforce system is called WorkSource Oregon. And that's just a partnership between several state agencies, education providers, and community organizations who coordinate to provide employment and training services to Oregonians. So that includes job seekers, and it may relate to things like finding and keeping work, developing new skills, getting a degree or professional credential. But WorkSource also assists employers in reaching new talent, training and upskilling their existing workforce, and also with some general operations management resources. And we'll dig into both of those a little bit more. In Clackamas County, we have one WorkSource center, which I've mentioned, WorkSource Clackamas, and some of the services available to job seekers might include, but are not limited to, access and use of technology. So computers, printers, scanners, audio, video equipment for things like digital interviews, stuff like that. One-on-one or small group resume and cover letter writing assistance, interview preparation, career exploration and job search assistance, skills assessment and skills development opportunities. Again, those can include free skills development workshops, which are offered weekly through various partner providers, as well as more in-depth training and education programs, which can range from short-term training, like a 2 or 3 month program, to longer-term training or education opportunities, like 2 or 4 year degrees. WorkSource can also provide some training as well as paid learn and earn opportunities, job and resource fairs and other employer engagement opportunities, as well as referrals to resources and assistive services for individuals enrolled in a training program or looking for employment. And that can include things like assisting with the cost of childcare, personal technology, food security, rental assistance, things along those lines. There are things that are available to job seekers that I have not covered here. And some of these things may depend on just availability of funds, as well as some information that's specific to individual job seekers. For example, veterans or people with disabilities may have things available to them through WorkSource, as well as additional resources tailored to that particular community. And again, since a lot of information to cover today, if anybody does want to know more about WorkSource, I'm happy to do follow-up, as well as connect you to a few of our WorkSource partners on today's call. And before moving forward, just wanted to show that image to the right indicates some, but not all, of our local partners in the WorkSource centers, which I know some of you are here today. And feel free to learn more at worksourceoregon.org as well. But again, happy to follow up and provide a more in-depth or detailed conversation about WorkSource and CWP. In addition to resources for job seekers and individuals, CWP and several other workforce network partners can assist employers and businesses in a variety of ways through an initiative called Clackamas Coordinated Business Services. Some of the things that CCBS can provide are relate to recruitment, hiring, and employee retention, training and skills development for an employer's current workforce, customized training specific to the needs of that employer, and helping employers develop earn and learn programs for employees or interns, as well as things related to layoff and closure prevention, and some things related to more general business operations, which can include expanding or downsizing businesses, general operations and HR counseling, as well as information on the current labor market. So if you'd like to learn more about CCBS and what available for employers through that, we do have a page on our website, clackamasworkforce.org. And there's several CCBS partners who can meet with folks and give them some more information on what's available and how to get connected. Great. So that was just a general information on not just CWP, but WorkSource. And I wanted to cover those because some of these existing resources or partnerships may be integral to the initiative that we're going to be discussing in more detail today. And just for clarity's sake, before getting started, I know behavioral health or mental emotional health, these terms may have a variety of definitions depending on the organization or agency who's providing that definition or the client that they work with. But for today, our working definition is what is on the screen in front of you, and is just going to refer essentially to conditions, ongoing conditions that can include depression, anxiety disorders, dissociative identity disorders, disordered eating, substance use disorder, as well as several other conditions that could be covered under that definition. But just wanted to provide a baseline for folks to work off of when we discuss behavioral health over the next hour or so. So before I begin diving into this, I just wanted to share that some of this information was pulled from the Oregon Council on Behavioral Health, as well as the Oregon Health Authority, Centers for Disease Control, and a few other state and national organizations. You may notice that there is some fluctuation in the exact numbers or percentages, and that's based on access to data, depending on where the organization compiling these statistics is located. They may have more or less access to Oregon-specific information, as well as some fluctuation in the years that some of these reports have been issued. But everything is current from 2018 to present. One thing that you will see, despite the differences that may occur in numbers or percents or statistics, is that there's kind of a common denominator about the state of behavioral health in Oregon. So according to the Oregon Council on Behavioral Health, there are 9% of Oregonians who have an unmet behavioral health need, compared to the national average of 6.2%. According to the Mental Health Association, there are 27% of adult Oregonians who have behavioral health challenges, which is 6% higher than the national average. The U.S. Census Household Pulse Survey indicates that there are 36% of Oregon adults who experience behavioral health challenges. CDC estimates state that 50% of Oregonians, this may include both adult and youth, have a behavioral health disorder. The CDC estimate also indicates that there are about 500,000 low-income, aging, or Oregonians with a disability who are not receiving treatment for a behavioral health disorder. Mental Health America has ranked Oregon last in accessible treatment, as well as having a highest rate in behavioral health disorders. According to the Oregon Health Authority's 2021 report to the state legislature, Oregon has the 4th highest rate of unmet treatment needs in the United States. And 18.6% of Oregon youth ages 12 to 18 report major behavioral health challenges, as well as from the Annie E. Casey Foundation's 2021 Kids Count data, there are 117,000 Oregon children who report having an anxiety or depression disorder. Some additional snapshots include information from the Rural Health Information Hub. 34 of our 36 counties are in a behavioral health worker shortage. The OCBH 2021 survey indicates that there are 10 to 30% reductions in the behavioral health workforce in an 8-month period. The OHA behavioral health worker wage study, which I referenced in that previous slide as well, states that 21% of behavioral health workers are not in the behavioral health field currently, or they are not working full-time in this field. Some of the causes that have been identified for this turnover or the lack of behavioral health professionals include low pay, lack of benefits, high workloads, student debt, which is in imbalance compared to their wage or their salary, as well as limited opportunities for advancement for workers with certain types of educational credentials. The lowest paid labor intensive positions are the ones who are most likely to leave the field, and those include drug and alcohol counselors, peer support specialists, qualified mental health associates, and qualified mental health providers. And we'll dig into those last two bullets just a little bit more as we move forward. So some additional causes for worker shortages include, as I mentioned, the education debt to wage ratio is not tenable for those low wage positions, which also are the ones with the highest amount of turnover. So the amount of money invested in their education and training is too much for the salary that they make once they enter that field. There are expensive educational requirements for well-compensated positions, which typically require a graduate degree or a post-grad degree. So if somebody in that low-wage role would like to move into a higher-paying position, they're not able to do so unless they return to school, which will add to their education debt. So as I just stated, that inability for advancement without continuing education. And there's also a financial burden placed not just on students who have to complete an unpaid internship for their credential, but employers also lack the ability to provide the supervision that's required for those student interns. So it can impact them financially when staff time is being used for intern management rather than service provision. An additional pain point relates to the reimbursement and licensing processes in behavioral and traditional healthcare fields. So the insurance reimbursement rate is lower for an unlicensed behavioral health provider, but to be a licensed provider, you need that graduate degree. So you're not able to get those higher rates of reimbursement without that graduate degree. The reimbursement rates are lower for behavioral health providers, even if the service they are providing is the same one that is given to a patient at a traditional healthcare provider who gets a higher rate of reimbursement from insurance. Billing and reimbursement issues specific to serving people with co-occurring disorders can create some challenges. So if someone has multiple conditions for which they need treatment, that situation can get a little untenable on the provider end. And then there's some general misalignment between the education requirements for behavioral health professionals, regulation and government oversight, as well as some of the industry structures that are guiding behavioral health. Digging into some of that information a little bit more, and this is just, I know many people on this call are very aware of this because you're either doing the work yourself or you are familiar with it because you're in an employment and workforce development related field, but wanted to share some of this foundational information to help paint a picture of what has led to the initiative we'll be discussing today. So those lowest paid positions that I mentioned are also, the ones with the greatest turnover. They are typically often filled by women, people of color, specifically women of color, a lot of times non-native English speakers, as well as individuals from other historically marginalized communities. There are, in addition to being in high workload, low paying positions, there are barriers to education and training, as well as licensure requirements that may limit the ability for some of those same groups to obtain some of those higher paying positions. That high turnover limits access to service broadly for people who are in need of behavioral health assistance, but especially for those who are low income in rural and under-resourced areas, our youth, older adults, as well as other marginalized communities. And in addition to the general high turnover and its impact on access to care for all people needing these services, that burden is felt more acutely by historically marginalized communities who may experience burdens to access due to financial circumstances or location, but also have to consider the ability for them to work with someone who looks like them, maybe speaks the language they're more comfortable speaking, they've developed a relationship with over time, as well as the amount of time they may have to, quote unquote, tell their story or share information about a condition or experience that might be traumatic to them. It may deter those individuals from looking for or trying to access and use services. Oh, excuse me, I'm gonna let somebody else in. And then lastly, some of these existing structures create disparities in access to care, as well as kind of hinder the ability for the behavioral health workforce to become more diverse and representative of people seeking services. Some of the recommendations for addressing these challenges from the Oregon Health Authority's Behavioral Health Worker Wage Report include creating reimbursement programs for employers so that they can host interns and supervise them without experiencing a financial burden. Similarly, creating learn and earn programs for interns so that they can be compensated and have the ability to obtain some of those, the degree result in licensed and paying jobs. Creating student loan reimbursement programs for individuals entering those high demand positions. Establishing career exploration programs for youth in the K-12 school system, as well as in youth provider programs, including after school, seasonal and summertime expanded learning programs. And creating programs and supports to increase the number of bilingual and bicultural professionals in the industry, particularly in management and leadership roles, as well as establishing mobile health services in under-resourced communities. And again, these are just some recommendations or examples of best practices and programs with demonstrated success that this report outlines. So a quick overview of the what brings us here today, the Healthy Oregon Workforce Training Opportunity Grant. So I know many folks on the call work in this realm, and they're aware of the recent investments over the last few years from the state in the behavioral health field. One of these includes the HOWTO grant. And the purpose of this is to grow and support the workforce needs of the healthcare industry more broadly. And that can include traditional healthcare roles as well as behavioral healthcare. So CWP, as some of you may know, has two operating HOWTO grants, including the one that we're discussing today. Our previous HOWTO grant is centered more on traditional healthcare roles like community health workers and certified nursing assistants. But we were awarded in March 2022 a HOWTO Round 4 grant award, which will establish a behavioral health consortium. And this is going to be the first of its kind in Clackamas County. However, there are some other behavioral health consortiums and similar projects taking place in other parts of the state. And our award for this grant actually mirrors the same project is taking place in the Willamette Valley region. So we'll be coordinating very closely with Willamette Workforce Partnership, one of the other workforce boards in the state, to implement these behavioral health consortiums. And the Behavioral Health Consortium of Clackamas, or BHCC, it's going to utilize an industry consortium model, which has been used in other industries in our area and has had some demonstrated success. And that includes not just healthcare and manufacturing, but also construction and technology. And the idea behind this consortium is to get employers from the industry, the target industry, behavioral health in this particular example, to be an active part in identifying key challenges as well as key solutions to the things that are creating difficulties in their industry. So the general objectives of this consortium will include diversifying the behavioral health workforce, ideally by removing some of those barriers to education and training, as well as employment opportunities faced by historically marginalized communities. Increase access to behavioral health services for individuals from marginalized communities in need of these this type of health care. Increase access to training and education for the current workforce as well as the emerging workforce, which refers to youth, essentially ages 12 and up at this point, and help promote completion of programs and entry into the field. Expand access for to essential supports for employers for current behavioral health providers. And these can include existing reimbursement and training programs or other grants and funding streams available to them. Work to enhance the quality of jobs for behavioral health workers in a variety of roles, primarily those which are lower paying and have the highest workloads and rates of burnout, by addressing things such as low wages, benefits, and organizational support for employees. And use WIOA funds as well as other resources to support existing trainings and develop new trainings to help meet these goals. So to give you an idea, as I mentioned, this really is sort of an overview with our official launch of the consortium taking place in early 2023. That is going to be really focused and directed by the needs, desires of consortium participants, primarily those employers, both private practice as well as public and nonprofit sector behavioral health employers. But generally, some of the expectations participants might be involved in could include helping collect and analyze data related to our local behavioral health industry, identifying some of those key challenges that are specific to employers in the Clackamas area, conducting outreach and asset mapping so we can better understand current resources available to help meet those employer needs, conducting that same kind of asset mapping to understand what's currently available to help meet worker needs as well as patient needs, identify and refine action goals to address some of these key issues impacting all parties, employers, workers, and service recipients, and establish relationships among these key constituents and other social and human service systems to help develop coordinated approaches to solving some of these challenges. And I'm going to pause in just a moment to see if there are any questions. There are a few additional slides after this, but I know it is a bit of information that I've gone over. So I want to see if there at this point are any questions from anyone in the audience. But consortium participants might include individuals and organizations like, again, employers, ideally key decision makers or managers or leadership from private, public, and nonprofit sector behavioral health providers. And part of the grant, which is funding this initiative, does involve compensation for these individuals to participate in the BHCC, similar to what I mentioned earlier with internships being a cost burden on employers because they have to spend time managing an intern rather than doing their meeting their daily responsibilities. We recognize that them taking time out of their workday to participate in this consortium is also a financial burden. So we do have funds available to compensate them on par with standard hourly rates for people in their positions. Additional organizations that we hope to get participation from will include labor organizations, so unions, apprenticeship programs, and professional associations. Adult education and training providers, including universities, colleges, and community-based organizations who do skills development and training. Youth education providers, including schools, after-school programs, and community-based organizations. Policymakers from the local, regional, and state level, as well as the potential for the service recipients, so behavioral health service users, people receiving these services to participate in some capacity. And I lied, I'm going to do one more slide and then pause. Some of the expectations around the Behavioral Health Consortium will be around establishing structure and operations. And again, this will be guided by those consortium participants. So expectations will include helping to establish, identify that local need, ensure consistent participation or representation from their organization, to meet on a monthly, bi-monthly, or quarterly basis throughout the duration of this grant, which is 3 years. And I want to make note that there will be times when we might meet more often or more frequently than other times. And there will also be phases of this consortium where certain types of participants may be more necessary than at other times. For example, the early stages may be really employer heavy, finding out what they're experiencing with their local workforce and employer pool. That might not be as relevant to education and training providers who work with students who are interested in becoming behavioral health professionals. They may be brought in at a later time and join meetings at a more regular pace when the group moves to focus sort of on addressing like education or training related activities. Participants may also be asked to engage in ad hoc committees or advisory groups as needed, and to assist in the continued development of strategic goals, action items, pilot projects, or related programs. And again, as I mentioned, this participation might ebb and flow overall. So the consortium total may meet more often during its first year than it does during its second year. Similarly, the employer participants might meet more often and then pause for a period of time while those CBOs and education and training participants take up more space and attention for the BHCC meetings. Oops. So I'll go ahead and pause. That's essentially the end of it, other than outlining some next steps, but I will wait a moment and kind of see what questions or comments or thoughts people have, and then talk a bit more about next steps. So I am going to stop screen share at this point, just because it seems more personal.
Hey, Brad, it's Eric with HOWTO.
Hey, Eric. Yeah.
Yeah, at the slide you have for the last one, you had mentioned that you were looking for community-based organizations that are participating in providing after-school program, which is what I do. So, how do you see a participant in like such as Todos Santos be a part of what you are looking at accomplishing?
Yeah, that's a great question, Eric, and I'm glad you asked that because I think for community-based organizations that there may be more questions that are not as direct or straightforward about the project compared to like what employers and education training providers might expect. So this is an example. Again, ultimately, I'll be the facilitator of this consortium, and there are, of course, ideas taking place, things taking place around the state and the country that we could use and implement and copy. But I think an example specific to your question is working to develop some sort of career exploration program with youth service providers as well as K through 12 schools specific to the behavioral health workforce. So if you think, I know you've done a lot of work around like STEM education and things like that, it could be a similar model that involves like employer presentations to youth interested in the field, site-based trips and activities, potentially developing a career and technical education program in a school district that helps equip a student for entry into this profession. So that's kind of a short answer, but I think there's also some room for some more creative ways to partner with youth service providers.
Do you see your participation going as far down as middle school?
Yeah, I think that, yes, I think traditionally the emphasis for quote unquote career readiness has always been on high school. I think middle school is an appropriate age, and one of, perhaps it wasn't as emphasized as much as like the workforce challenges, but one of the goals of this grant is to increase access to behavioral health services for communities that typically don't have as much access to them. And one of those in Oregon is youth. So I think there's some room to explore partnership in that area as well.
I've got to take off for another meeting at 4 o'clock, but I'd be very interested in talking with you. And I've got you hired a new youth career navigator for the middle schools. Would it be possible to have a Zoom meeting with you and the youth career navigator and myself and maybe discuss this further?
Absolutely. Yes. I'll be sending some follow-up to this group as a whole, as well as some folks who could not attend today. And then we can also coordinate one-on-one. So yeah, that's definitely
Thanks a lot.
great. Brian, I see that your hand is up.
Hi, Brant.
Hi, long time no see.
Yeah. Something that I was thinking of, really excited about this grant and what you guys have going on. Having a countywide youth and drug and alcohol prevention coalition, brings to my mind as you're trying to recruit, and however you wrote this up in the grant. One of the things that I struggle with is that whole idea of, so many groups out there, right? So is there any kind of what's in it for me or what's in it for us, like that you are thinking or have written up? Because I know, and that's the first question. The other is, I know there's still a lot of stigma around mental health. And so, I just see this as being pretty challenging work to try to get folks on board and active.
Yeah, absolutely. I'll kind of address that in two parts. I think with the first one, the what's in it for us answer is probably will be dependent on the audience in a lot of ways. Ideally for the employer community, the what's in it for them would be a more consistent and reliable pipeline of workers, as well as reduced employee turnover, ideally. So that their business or organization, et cetera, is just more stable. I think the what's in it for us as far as nonprofit or community organizations and education training providers who might be participating as a partner is more opportunities for the folks that they're working with, both as far as employment may go, but also more opportunities for people that they're working with who might need these types of services. Working to address some of the labor shortages in the industry will increase the service availability. And again, a lot of these are longer term, which I know is not as appealing as instant gratification sometimes. I think for that same, the CBO and education community, it may also mean access to new funding streams for in program development. So there may be a bit of financial incentive in that way. And then I guess for the third pot, the way I'm thinking of it, of stakeholders, which would be maybe lawmakers or elected community leaders, as well as community individuals, would be addressing some of the challenges that are impacting Oregonians which not only are a burden on them and their personal life and their families, but also disrupt their ability to do things like find and maintain employment, complete education programs, things like that. I know CWP, as well as some other folks on this call, probably we still, even now after the great resignation or quiet quitting, etc., there's still so many jobs that are available and are not being filled. And some of the challenges around filling them may relate to people's abilities to be able to work. So ideally, this would help provide some solutions to that. And lastly, just about you're right, the stigma with behavioral and mental health, that probably will be a challenge. And I'm sure, especially when it comes to organizations who maybe don't see themselves as, they're not behavioral health providers and it's not core to what they do, there may be a lot of legwork needed to promote buy-in or understanding about why this is going to be important to them. And I think that will just, ideally, the consortium will help address that by providing, an array of different voices, not just the touchy-feely do-gooders, advocates, nonprofit people, but also we're going to have educators, business owners, private sector employers, all kind of in chorus. I don't want to say sounding the alarm, but highlighting the benefits of working together to address these challenges.
Great, thanks.
Yeah. Are there any other questions at this time or comments?
Brent, I have a quick question. So looking at the objectives and then also looking at what the participant roles would be and such, can you foresee a time frame of when some of the implementation of these outcomes, and the data that's gathered and then the collaborations with the partners and those kinds of things, do you have in your mind like a time frame of when that implementation would take place within some of our systems?
Yes and no. So there's some outlined objectives in like the phase of the grant that we hope to accomplish them. That do exist, and I will work as the facilitator to try and kind of be in line with that timeline, since it is a 3-year grant period. But I know a big goal of the consortium is to be kind of directed by those most impacted by behavioral health issues right now. Primarily, the emphasis is on like the behavioral health workforce. So employers are really, I imagine, at the beginning going to be kind of helping set the tone and pace for that. That being said, what I imagine how things will probably unfold is starting more with that employer voice, both managers and leadership level, as well as or frontline workers who are often in these like high turnover roles. So like what are the general pain points you're experiencing at your organization, kind of compiling and looking through that data.
Right.
And also I think the next phase after that would be more of that system wide integration. So here are these local pain points as well as some existing resources. Now, what else is out there that can give us a fuller picture of the challenges, but also a fuller picture of the solutions? And then kind of both in that phase and the third phase would be where organizations like the community college or ERCO or Northwest Family Services, as an example, or would come in and say, hey, we can develop a program or provide a training that can then help increase the number of people entering this field, or reduce the amount of time it takes for someone to enter this field, or speed up the process for them to move from one type of position to another type of position.
Right. So some of the findings could follow up with some additional RFPs and things like that to support.
Yeah.
Correct.
Yes.
Is how you see it. Okay.
Yeah. And again, that is just kind of from thinking of it right now.
Right.
Something that occurs that throws a wrench in that like planned process to move forward or planned timeline. But I think that ultimately that will kind of be the general process is what do things look like in the here and now for employers as well as like training and education providers. And then what kind of things can we do collaboratively moving forward to expand those existing resources and create new resources and opportunities and pathways.
Awesome. Yeah, great. Thank you.
And I, of course, will be sending out some follow-up because I know this is a lot of information in total at one time. And there might be some questions that come up after people have some more time to process. But wanted to open it up to any additional questions or comments before kind of moving forward with what our next steps are looking like in this moment. Great. Well, I'll do another screen share quickly. There's not too much left. There's really only one slide left, but for those who appreciate a visual reference, let me get that back up there. Excuse me. So our next steps would be, some of you may have read this in some initial emails related to today's event, but we did, prior to being awarded this grant, received letters of commitment from several organizations, both private sector behavioral health providers, as well as community-based organizations and education and training groups. So where we are now is just reaffirming with those who've already committed to participating, their ability to do that. And then at that same time, I will be sending out a follow-up to people attending today's information session to see who's interested in learning more and in participating in the Behavioral Health Consortium. And once that we've affirmed interest from other organizations, we would move forward with outlining and finalizing some sort of memorandum of understanding or contract for what participation in the consortium looks like. Again, that may look different depending on the type of organization that we are, talking about. Nonprofit organizations, the school district, et cetera, their involvement may look different than a private employer. So outlining what those things are based on the individual partner who will be joining the consortium. And then through that roster of initial partners, we'll determine a kickoff date in January or February of 2023. And that will serve as our opportunity to establish what, in more detail, what structure for the consortium looks like. So meeting flow and frequency, duration of meetings, expectations around participation and things along those lines. And then we will use that as a basis for kind of moving forward in both goal setting as well as developing any additional task force subcommittees, things like that we might see as necessary for achieving some of these goals. Again, this is just my perspective here and now with that initial kickoff meeting, I think being the time that consortium participants will really determine this, but I would see the whole group having at least 4 to 6 meetings initially, whether those are twice a month or once a month. And then from there, the meeting structure and frequency may fluctuate a little bit depending on the topic or the goal we're working to address, as well as the entire consortium may splinter into subgroups or work groups that are more active, with the whole group meeting less frequently, and meeting mostly to share kind of information and updates and things along those lines. But again, I think some of those things will be determined by consortium participants themselves, but wanted to provide a little bit of expectation for you all in what we are thinking early 2023 will look like for this particular project. So I'm going to stop screen sharing again. Any other questions or comments specific to follow up? Sean.
Hey, Brent, thanks for having me. John Ellison from Kaiser. In reference to your last slide in terms of a survey, when affirming interests, are you thinking to give a little more detail or about what range of participation people would be interested in committing to?
Yes, yeah, I think, and it may not be in that survey form, but to your point, that I think will be in those conversations around like an MOU or just an understanding of participation, whatever you want to call it. I think that there will be some general things that apply across the board in one way or another to probably all participants. But we do want to structure it in a way that we're ensuring we can kind of utilize participants to the best of our ability within the restraints that they may have.
Yeah, I think that would be good.
Yeah, I expect some folks, for example, let's say, Kaiser Permanent, very large organization, and someone from KP may be able to, join 4 initial meetings to do X, Y, and Z. And then we'll stay on the listserv for email updates and maybe pop in from time to time. During that kind of MOU or contract process, we would outline what that looks like a bit more.
Oh, okay, great. So the initial survey response will be just open to having a dialogue about what participation might look like.
Yes. Yep. Yeah.
Okay.
And I will include some, to your point, some examples where people can indicate up front, like, hey, these are the things in which I'm most interested in as far as activity or topic goes. And here's my expected ability for frequency of participation. Some people, if they're, for example, Clackamas Community College, if they're providing these types of trainings anyway, this may be something that they can participate in more frequently than an employer who is really just kind of advising on challenges and solution building.
That sounds good. Just a suggestion, might also want to ask people what kind of expertise or skills they would like to contribute. So, then you can get some assistance as well. One thing that comes to mind is, I think we probably all have this orientation in our organizations, but having someone with an equity, inclusion, and diversity background, I think would be really helpful to kind of just even add new ideas to the different task forces. Even if they're not a professional in that area, they would bring a different way of looking at things.
No, you're absolutely right. And I know with one of the objectives being workforce diversification and increase to access, I see that will kind of have a very big DEI focus, but also we want to make sure that the entire consortium and any activities related to it also have that lens interwoven in them. So yeah, thank you for stating that. And I see Sarah has a question. I did want to make a quick comment with the idea. I'm saying MOU and contract. I don't want that to scare anyone off. Outlined in the MOU and contract is like next steps, or not next steps, but if you're no longer able to participate as an organization or an individual, there are options for you to have an out, so to speak. So I don't want anyone to think that they're in some sort of menacing binding thing. Sarah.
Yeah, thanks. Can you hear me okay?
Yes.
Great. Yeah, so Sarah from United We Heal. I'm managing a QMHA apprenticeship program, Qualified Mental Health Associate. And I was curious if you could speak a little bit more on kind of what you're talking about earlier in the other Q&A about In the executive summary, you had written how you can use some WIOA funds for training contracts to educational institutes particularly. And I was wondering if you could kind of speak a little bit more on that, what you're thinking that looks like.
Yeah, and Sarah, I will say up front, I can give you an idea. I think my role in this is more of getting the people with greater wells of knowledge about those particular things in the room to better explain and outline. But through WIOA funds, as well as some other funding sources, well, I'll answer kind of in two parts. Some WIOA funds that already exist, as well as some additional resources through like the Clackamas Coordinated Business Services team that I referenced earlier. Those things are already in place and available to really a variety of employers from any industry to do things like establish or support an apprenticeship program or an earn and learn model or something along those lines. So part of it would be connecting employers to some of those existing resources so that they can move forward with using them. The second part would be looking for or seeking funding streams that are specific to either the behavioral health industry and supporting the workforce, or specific to a type of program template that could be used in any industry, but applying it to behavioral health. So I guess an example for that one would be funds related to like K-12 career and technical education programs. Really, CTE can be done for any type of job or industry, early childhood education, hospitality, construction, etc. So those models exist. It would just be a matter of getting the resources and funds necessary to develop one that's specific to behavioral health. Did that answer your question? And I will fully state, as far as funding streams, I'm not the most knowledgeable at CWP, but can definitely connect you with other folks like Amy Oakley, Bridget Daisy. I know you know both of them. They are well versed in the technical details of WIOA funds.
Yeah, perfect. It seems like a follow-up conversation will be really helpful. Thank you.
Yeah, absolutely. And Amy Oakley too facilitates the coordinated business services team. So that's really her wheelhouse, is the employer supports. I'm typically job seeker and CBO facing. So this is my first foray into any employer related activities. Any other questions about anything outlined today, or expectations around follow-up and next steps for moving forward?
Brent, is there any additional help you could use from the participants, or any additional feedback you need other than just responding and kind of agreeing to participate and move forward?
At this time, I think it's like a yes and no. Part of with it being the time of month it is right now, imagine I will be sending out some communications on the 27th. As that I'll do a follow-up tomorrow, but tomorrow's follow-up will be some very basic information and a additional follow-up on 12/27. So why I bring that up is because I think now, before our official consortium launch, as well as throughout the duration of the consortium, whether it's 3 years and ends when that grant ends, or becomes something that is ideally sustained beyond this particular funding cycle, I think assistance from you all would be helping to get additional participants to join in, either limited duration or to whatever ability and capacity they have. And as part of that follow-up on December 27th, what I would like to include is, I guess, a one-pager, for lack of a better term, related to the consortium and how folks can get involved or get connected to me or one of my CWP colleagues to learn a bit more about that.
That sounds good.
Well, as I just mentioned, we'll be doing a little bit of follow-up tomorrow. I'll include an attachment of that presentation and a link for this recording, as well as some general kind of bullet point next steps and expectations for all of you over the next few weeks. And then we'll do some continuing education in January about the consortium kickoff, as well as finalizing and sharing some of those things like the MOUs or contracts, and working out details for individuals and organizations looking to participate. And I was going to say that will be, well, never mind. We'll save it for later. I will just say we have some who it will be a very specific individual who will be involved the whole time. I imagine other participants will have multiple people trading in and out. So there are opportunities for both kind of those approaches or methods. All right, well, I'm going to hit the stop record button real quick.